Hello, everyone. Dr. Max here. Well, I got a BIOHM microbiome stool test recently, a few days ago here, and I wanted to take this opportunity to give you an example of what it looks like when you get your score. So I had to take screenshots of them because when you click on print, you lose some of these graphics here that are helpful for visualization. So I had to do with a screenshot, but no worries there. You'll be able to see them just fine on your home computers when you get the results of your stool test back. So they give you an overall gut score that's based on four different criteria. The overall diversity of all the microbes in your microbiome in the stool sample, the beneficial species, all the different fungal and bacterial species that are helpful for human health, the pathogenic species, species that are known to cause symptoms or disease in individuals, as well as the phyla balance, which is the overall balance of the different families of the microbiome. So the higher the score, the better. So a 6 for this individual's is all right, kind of middling, so could be better, but they do have some good microbial diversity, so we'll get into that here. So the more different types of bacteria and fungi you have in your microbiome, the better overall. Um, the more diversity you have there, the easier it'll be for your body to break down a wide variety of different foods and be able to handle a wider variety of different insults, whether that's, you ingest pesticides, heavy metals, you get an infection, you're dealing with a lot of stress. It basically helps, support the overall resiliency of the body and helps you bounce back from things more effectively. People that have a history of a lot of antibiotics typically have a much lower microbiome diversity, so this is actually pretty good. Um, Grouping of similar species, as I said, the phylum, it's like similar to overall bacterial families with all the different cousins. Some of them are helpful, some of them are pathogenic, some of them are just neutral and kind of hang out. And depending on the foods that you're feeding your microbes will determine the overall abundance of these different types. So you can see there is some imbalance here. Some of the different phylums seem like they're okay. Some of them are not. And they go into the specific species and genus of some of these overall phylums here in a minute. But you can see that this person has some imbalances, which can be a sign of dysbiosis or microbiome imbalance. In terms of the beneficial species, person's okay. They've got some of the good guys, but some of the important ones are missing. So when we look into this individual, you can see some of the most common beneficial species like Lactobacillus and Bifidobacterium that you find in a lot of yogurts and probiotics are pretty low in abundance. So right away, this individual is probably a good candidate for an overall probiotic supplement. You can see that some keystone species like Faecalibacterium prausnitzii and Akkermansia muciniphilia, these two species are quite low, in particular Akkermansia. They're called keystone species, and that's why they highlight these species in particular, because they are known to promote human health in a pretty profound way. So either supplementing with them or having diet and lifestyle changes that support increased numbers of Faecalibacterium prausnitzii and Akkermansia muciniphilia are beneficial for human health. You can also see this individual has very low, almost undetectable levels, well, I guess undetectable levels of Saccharomyces. So Saccharomyces, this is a type of yeast, a fungi that is beneficial to human health. There are certain yeast that just like to hang out and some that can overgrow, like Candida is a very common one. And so supplementing with Saccharomyces or having an abundance of Saccharomyces in your microbiome already can help prevent things like Candida from overgrowing. They can help to kind of crowd out that fungal niche and prevent Candida from becoming unregulated. So this individual, you can see they definitely have some room for improvement. Most of the beneficial species that are known to us humans are low or just not really present in this individual. As far as pathogenic species, species that can cause disease or side effects in individuals, nice that we can rule out C. difficile. This one you find in a lot of intractable cases of Crohn's disease or people with really relapse remitting types of digestive dysfunction. So that can be a tricky one to get rid of. E. coli, present in nearly everyone in relative abundance. This is typically not a big deal, but it can overgrow, and that can be an issue. If you've heard of endotoxins, LPS, that can cause inflammation and symptoms in people, E. coli is a very common source of that, a gram-negative bacteria. Basically, gram-negative bacteria have this molecule on their membranes that is recognized by the immune system. And when the immune system encounters that, it creates inflammation. So if you have leaky gut and either living E. coli or waste products from E. coli, even the outer membranes of dead E. coli get through the lining of the gut where they're exposed to the immune system, then that can create inflammation that can become systemic and lead to symptoms far away from the gut, like joint pain, skin issues, brain fog, even implicated in some neurodegenerative conditions now, like Parkinson's and dementia. Thankfully, some of the other pathogenic species are not present in this individual, like H. pylori, Citrobacter, but you can see, hey, they have Candida overgrowth. So this is that yeast that can be normally present in some small amounts, but has a tendency to overgrow and become pathogenic. This one is very common in Americans who eat a standard Western diet with lots of carbs, sugar, alcohol, because that feeds the pathogenic yeast. So this individual not only has low amounts of the beneficial microbes, but they also have high amounts of Candida. So we would say this individual has Candida growth, overgrowth, and they also have dysbiosis because they have low levels of beneficial microbes. Something cool about this gut report, because it's doing a PCR DNA analysis of all the bacterial and fungal species that they can, you also get some additional insights into some other species that can, excuse me, cause symptoms in some individuals, but often don't. It seems like for this person, they also have a couple overgrowths, Ruminococcus, as well as the zygomycota. So this individual has bacterial dysbiosis, fungal dysbiosis. So chances are, if we did some SIBO testing or some SIFO, SIFO, small intestinal fungal overgrowth, we would probably get a positive result based on these results. Something cool about the Biome Gut Report is they also provide you insights on how to improve the results and improve your gut score. So for this individual, reducing sugar, processed carbs to help cut down on Candida, the pathogenic yeast that can cause bloating, sugar cravings, brain fog, systemic symptoms like toenail fungus, fungal growth on the skin, etc. Often people with fungal overgrowth, you'll see they have a really white coated tongue in the morning. A simple hack to see if you have a really bad Candida overgrowth is to leave a glass of water out overnight. So in the morning, it's just room temperature, tepid water, and then spit into the water right when you wake up. Then, go brush your teeth or take a shower or what have you. Give it 10 to 15 minutes, come back to the water. If you look in the water and you can see little strands of white material kind of floating down from the top of the water, where the spit is floating on top of the water, that those are strands of yeast overgrowth. So a really easy way to tell if you have fungal overgrowth in the mouth. Some other dietary recommendations, including anti-inflammatory foods that help to balance the dysbiosis this person is dealing with. So foods high in antioxidants, vegetables, fruits, herbs, basically as many spices as you like. Feel free to use plenty of spices, lots of antioxidants in those, as well as the omega-3 fats, very anti-inflammatory, found in cold water fish or algae oil. You can even get some anti-inflammatory omega-6s in evening primrose, borage oil, or blackcurrant oil. Um, let's see. Practicing healthy meal habits to support proper digestion. So oftentimes with dysbiosis or Candida overgrowth, an individual is not getting proper digestive support when they're eating meals. They're either eating when they're stressed, or they're eating too quickly, too large of meals, or maybe they're diluting their digestive juices by drinking too many liquids with foods. So you want to focus eating in a calm, undistracted space, trying to relax as best you can. Some hacks I've mentioned before are taking some belly breaths, the diaphragmatic breathing to activate the vagus nerve, that rest and digest nervous system. trying to take in your food, look and smell it before you eat. If you start to salivate, produce saliva, then that means your body's in rest and digest mode and you're ready to eat. Make sure you're chewing thoroughly, 20 to 30 chews per bite until the food in your mouth is sort of a paste, and then you can swallow that, and that's much easier on your digestive system than swallowing whole bits of unchewed plants and animal proteins. And then eat away from electronics, not distracted as best you can. Try to focus on your meals. If you incorporate some breath work into your life, that can help to reduce stress. We're just beginning to really recognize the vast importance of the gut-brain axis and how stress and mood play such a role in our digestive health. So doing some breath work, trying to calm down your stress level overall can be very helpful. Stress has been linked to dysbiosis, inflammation, and digestive symptoms. Who among us doesn't know somebody who has a nervous stomach? That might even be you. Decreasing fast food intake. So basically, all these great diet and lifestyle recommendations, um, and they explain why they are important. So for this individual, stabilizing the microbiome for dysbiosis, calming down inflammation, using overall digestive support, helping with their stress response, and making sure that they can actually break down food with things like digestive enzymes. This being standard process in MediHerb, they also recommend some of their products. Here, Gut Flora Complex has pre and probiotics in it to balance dysbiosis. Turmeric Forte is a specialized type of turmeric that's much more bioavailable than many on the market. GI Adsorb helps to bind up and remove toxins and toxicants from the digestive tract. Ashwagandha is a very commonly used adaptogen that helps the body handle and manage stress. I believe in Sanskrit it means the power horse. I also find it helpful for people who are dealing with insomnia and can't calm down in the evening, as well as Enzicor, which is their digestive enzyme support. So this is an overview of the BIOHM Microbiome gut report and its insights. I hope you found this useful. So when you get your report, you'll have a better idea of what to expect.